So you are showing a graph that I generated, my organization generated. And this is actually, you're looking at the experiment that got me into food as medicine. Let me explain to you the experiment. I'll put it over here. So we were studying at one point drugs, and we're trying to discover drugs that could be developed as cancer treatments. So what we're looking for are drugs that could cut off the blood supply to tumors. So we were screening lots of chemicals that biotech companies were developing and inventing, and professors were inventing, and said, hey, can you take a look to see this could be a worthwhile drug that could cut off the blood supply to a tumor as a cancer treatment? All right. And at the time, there were no such treatments. So it was all discovery. Like this was, like the golden age of discovery when it came to angiogenesis. We were testing, oh my gosh, this thing could really stop blood vessels. Could we develop this into a cancer treatment? Ultimately, yes. The answer was yes. But we were looking for them. And so we developed a system where we could add a substance into a laboratory test system to see if blood vessels would grow or shrink. And so here on this graph, you can see at the very top, a very long bar of blood vessels growing. That's normal, healthy blood vessels growing out as long as they can. And then what we would do is we'd throw drugs into it, and we would see if we could actually shrink them up. And so some of the shorter bars are cancer drugs. You can see them in this color in blue. Not surprisingly, some of the cancer drugs were making the blood vessels smaller. Hey, this could be a good candidate drug. And we were also testing other drugs that were available, not used for cancer, to see if they would work. Sure, we discovered some of those too. But I did something a little bit subversive. And as you know, if you want to be disruptive, you got to sometimes disrupt yourself in order to be able to do this. So this is like our experiment that we were doing at the Angiogenesis Foundation. We decided to disrupt ourselves. So we said, we have a whole system of drugs to test. Let's remove half of them and let's swap them out with powders that came from food. All right, just to see what would happen. And when we actually tested foods in the same system used to develop drugs, food as medicine, tested in the same system that medicines are developed, we found what you see on this bar chart in red. We actually found that dietary factors, stuff that's found in food, could actually cut down the blood supply that would be growing to feed a cancer. In other words, there's anti-angiogenic foods. You could see the green tea, you could see the onions and garlics and red grapes and strawberries. It was really an eye-opener to me. For when I saw these results, it made my jaw drop. And I said, my God, foods have potency just like drugs. I was a skeptic. All right. And it just made me realize, like, this is something that I had to pursue. This was an area of research that I absolutely had to actually look further into. A drug takes a decade and $1 billion or more to be able to develop from scratch to reaching a patient. And then not everyone who needs a treatment can actually get the drug. But a food has immediacy. If you discover something amazing about a food, whether it's matcha, whether it's purple potatoes, whether it's a strawberry, that immediacy could be used beneficially without toxicity. All right, and affordably. And so I just saw this as this experiment is what brought me into the realm of food as medicine.
So I'm going to ask some stupid questions here. So on here, I can see that, for example, soy extract causes less angiogenesis, which
Yes.
from what I understand is the growth of these blood vessels. But does that mean that if I have lots of soy extract or artichoke or parsley or berries, that it's going to cause other parts of my body not to grow blood cells?
So this is the great question. Let me kind of reframe the question as you're asking it. If experiments are able to show that certain foods can prevent blood vessels from growing, will that actually cause a problem with your body's health defenses to keep blood vessels from growing in healthy tissues?
Yeah.
All right. Answer is no. And here's why. As a health defense system, our angiogenesis system is completely designed to yoke in the right number of blood vessels to give just the right amount of blood flow. Not too much, not too little. I call it the Goldilocks zone. You know, Goldilocks, the fairy tale. The bears were home invaders. They broke into the house and they were looking for chairs and porridge and beds, not too hot, not too cold, but just right. All of our health defenses, including the angiogenesis health defense, is hardwired to keep the body just right. So what that means is that eating foods like artichokes or strawberries or soy can actually help your body prevent extra blood vessels from growing towards cancer, for example, and other disease tissues, but it will not override the body's natural ability to get the right amount of blood vessels to the right tissue. So you don't have to worry about starving your healthy tissues. You're just cutting off the bad blood vessels of the tissue. I call it like a landscaper on a golf course that breaks out the lawnmower to mow that the golf course so it's got a perfect level of the lawn. You're not going to actually carve out a bald spot in a country club. You're going to get just the right amount. Similarly, and we're not talking about this graph, there's another graph that can actually show foods that you can eat that can grow blood vessels, healthy blood vessels, where you want them. And it turns out things like fruit peel can actually do that. And barley can grow new blood vessels. And dark chocolate can actually help to support blood vessels as well. And some of these things can also work on both sides of the equation. They can prune away the bad extra blood vessels and they can grow them whenever you need them. So your body is sort of like the gardener extraordinaire. It knows exactly how to actually tend. You give them the right ingredients, they know exactly where to put the grass seed, and they know exactly where to mow the lawn.
Have you ever had cancer in your family?
Yes. Cancer has touched my family like it has for most people. I had two uncles years ago that passed away. One passed away from colon cancer, one passed away from liver cancer. And, I was a doctor at the time. And so I felt so helpless because as a doctor, I could diagnose, I could lay hands on, I could feel the hard liver, I could feel the masses, and I felt at the time helpless. Even though I was doing the research, cancer research, and finding future paths, I felt like we're not there yet, and we can't. I couldn't help him. I felt powerless. Fast forward, we're now at a point where we're beginning to see the light at the end of the tunnel. And when my mother had cancer, so my uncle's sister, my mother, wound up having endometrial cancer. She was 80 years old. One day, had some bleeding, went to the hospital, found a mess. She had a hysterectomy to remove her uterus and ovaries, and they found in there an endometrial cancer. That's a cancer of the lining of the uterus. The surgery and a little bit of radiation was supposed to take care of it. Unfortunately, in her case, those little cancer stem cells, and it was microscopic cancers that were present, raced off in her 80-year-old body, which, weaker immune system when you're 80. And within a few months after successfully recovering from the surgery, she had stage 4 cancer everywhere. All right. And her oncologist told me, Dr. Lee, you're a doctor as well. This is serious and this is pretty much the time of game over. And now times have changed. Science has advanced. Progress has advanced. At that time, when my mother was diagnosed with stage 4 cancer, immunotherapy, the latest and greatest, I think, advancement in cancer treatment, had just broken through and become approved. Immunotherapy is not chemotherapy. It doesn't actually poison the cancer. Immunotherapy is a medicine that you give a cancer patient that wakes up your own immune system. Whether you're a young person or an old person, it can wake up your immune system. All right. And my mother had immunotherapy. She was one of the early patients that got immunotherapy. And her own 80-year-old immune system woke up like an army of super soldiers and went after that cancer. Now, we completely adjusted her diet so that her body between treatments would be as strong as possible, shields raised, as we've been talking about. And we gave her a little bit of radiation to help her immune system spot the cancer. Guess what happened? 3 treatments of immunotherapy, 3 weeks apart. So time 0 is the first treatment. 3 weeks later, the next treatment. 3 weeks after that, the next treatment. All right. So we're talking about a total of 9 weeks of 3 treatments. All right. Of these 3 treatments, we scanned her. Stage 4 went to stage 0, and she never had chemotherapy. Now, chemotherapy can be helpful too with immunotherapy, but this was where I saw firsthand, close up in my own family, the ability to harness your body's own health defenses in a way that I couldn't do for my uncle 15 years ago before, and we lost him. And we were to save my mom. And I can tell you, I literally had dinner with my mom 2 days ago, and she's 90, 91, 10, 11 years later, completely healthy, completely cancer-free. And by the way, this immunotherapy, if we could only get this to work as well for everyone, this is where we are in the history of medicine. We can see an end.